Hi everyone, my name is Michelle Habla and I'm the program manager here at Wremlex, and we're going to be talking about incident reporting. All right, so a serious incident is any event or circumstance that causes or could cause harm to the health, safety, or well being of an individual. This includes death and serious injury. Serious injury, an injury resulting in bodily hurt, damage, harm, or loss that requires medical attention by a licensed physician, doctor, or anybody that works in medicine, physical, physician assistant, or nurse practitioner. So there are three levels to serious incident. So just remember, a serious incident or serious injury is any injury or incident that required you to go to the hospital. Any time that you are going to see a licensed healthcare professional, you need to let me know or any of the admin staff know that your individual was involved in a serious incident or obtained a serious injury. And again, a serious injury or serious incident is any injury, any incident where they have to go and be seen by a healthcare professional. So it could be as simple as tripping and, maybe scraping their knee and needing stitches to as serious as breaking their leg and they need to go to the hospital. So anything where you are there, you are present, and the individual had to go to the hospital, or you had to take the individual to the hospital. So, a level one is any incident that doesn't fit into the criteria of level two and level three. So, our level ones look more like our incidents that are everyday kind of incidents. So maybe you were cooking and they accidentally cut themselves with a knife, just a little bit where they would need a stitch or that kind of thing, just a band-aid, and you just deliver, first aid, get them a band-aid. Just put that in your note. Please document it in your note, but you do not need to call me and let me know. It's not that serious. If they fall, but they get up, they say they're fine. They don't report any pain, but and they're okay and they continue walking normally. You don't observe any, like issues after the fall. That's level one. Just document it. But level two is if they fall and they twist their ankle and you have to take them to the hospital. That's a more serious incident. So yeah, so that's level two. So, level two serious incidents include a serious injury, an individual who is missing or was missing, an emergency room visit, and an unplanned psychiatric or unplanned medical hospital, admission of an individual receiving services other than licensed emergency services. So, if they're admitted into a psychiatric hospital for whatever reason, choking incidents that require direct physical intervention by another person. So let's say they quickly inhale their food and they cough it out and they're fine. You can just document that. But if they inhale their food and they're, full on choking and you have to hit one of these, like hit them on their back, you'll learn all this in CPR. But hit them on their back or do the Heimlich maneuver, then you need to call and let us know that that happened. If they ingest any kind of hazardous material, so like chemicals, food, anything that is not edible or food, please call and let us know. Any diagnosis of an ulcer, any diagnosis of bowel obstruction, which is, I guess, in layman's terms, constipation or a little bit more serious than constipation, and aspiration pneumonia. Aspiration pneumonia is when an individual, instead of the food going into their stomach, it goes into their lungs. So anything that's not air going into the lungs, and that can be spit, throw up, food, water, anything that goes into their lungs and stays there and builds up to the point where they get pneumonia and they're coughing out like black, green, or discolored phlegm, you want to tell us about. So a level three is any death of an individual. So if the individual dies, God forbid, on your shift, please let us know. Any sexual assault, if the individual reports that they've been sexually assaulted, that's a level three. So please, please, please let us know. If the individual attempts to unalive themselves or commit suicide, please let us know. And any deaths that occur in the hospital or at a result of injury or illness, these are level three incidents. Please let us know. But the main thing that the whole moral of the story is please let your supervisor know. What has happened and what you had to do. The provider shall to collect, maintain, and report or make available to the department the following. So when you report an incident by calling, we're going to send you a form that you need to fill out. And that form needs to be completed no later than 24 hours because we have to report it to Medicaid within 24 hours. So you need the date and the time, the place the incident occurred. So the specific location, like if it was in their house, if you were at in the community, at the store, at the movies, at a concert, wherever the incident occurred, you're going to want to note that. Circumstances of the serious incident. So you want to, I think, before, what happened after. So we were walking downtown and the individual tripped and fell and hurt their knee. They started crying. I asked them what was wrong. I helped them to sit up and I called 911 and I called you. Those are the circumstances. So you would need to definitely remember those. What support was offered? Did you give them CPR? Did you do first aid? Did you call 911? Did you get them a pillow? If they fell to get like to keep them more comfortable, whatever you did to help that individual when they encounter that situation is what you're going to document. So in conclusion, it is everyone's responsibility to report when an incident occurs. DSPs are to call and inform their immediate supervisor or the office immediately after an incident occurs. We are required to report the incident within 24 hours. After reporting to your supervisor, you are required to write an incident report explaining the circumstance of the incident and the support you offered during and after the incident. All healthcare workers and providers are mandatory reporters, meaning if your individual says they plan on hurting someone else, like they have a full-on plan, like they're going to hurt somebody, they're going to unalive somebody, you have to report that to your supervisor. If they plan on hurting themselves, you need to report that to their supervisor. If you feel like they are in danger or anybody else is in danger, you have to report that to your supervisor. So yeah, that's it. Thank you for